We'll be starting the session in just a moment. If you have any connection or technical issues, try refreshing your browser first. If this doesn't work, please go to the Help Desk by clicking Sessions on the left, or click the People tab on the right and search Help Desk to send a private message. Thank you for joining us.
Welcome, everyone, to this 5th week of our Menus of Change Leadership Summit, the virtual series. Welcome to you here in Hopin, and welcome to you watching live on our live stream. I am Anne McBride, Deputy Director of the Torre Barra Mediterranean Center, a joint project of the Culinary Institute of America and the University of Barcelona. Building on work and research by people like Greg Drescher here at the CIA, Dr. Walter Willett at Harvard, Dr. Ramon Estruc at the University of Barcelona, and cooks and writers throughout the world, we develop programs that translate the well-established science around the Mediterranean diet into actionable strategies for the industry. The foundational principles of the Mediterranean diet, from eating lots of produce and little red meat to emphasizing pleasure and community around eating, from the importance of physical activity to the fact that a glass of red wine does the body good mostly, are more relevant now than ever, and very much in line with the principles of Menus of Change. More and more research, including the influential SUN study from the University of Navarra, is also proving that the Mediterranean diet is one of the world's most sustainable ways of eating. We'll talk more about that in a digital magazine we'll be producing this fall, along with other virtual programming. So, thinking about health, sustainability, and flavor, it's been incredibly inspiring and informative to learn from the caliber of presenters featured on the Menus of Change program week after week. To catch up on sessions you couldn't attend live, you can watch on-demand recordings at menusofchange.org. And you can access all presentations and recipes on this same website using the password you received by email if you're a registered attendee. The advantage of this virtual platform is that a lot more of you are able to learn from this program, and to do so tuition-free, thanks to the generous sponsors of Menus of Change. Join me with virtual claps to thank our platinum sponsor, Kellogg's Away From Home, our gold sponsor, Land O'Lakes, our bronze sponsors, Nestle Professional and Oatly, as well as our supporting and corporate sponsors. Please make a point of visiting them in the expo section during the break and reception. During the break and reception, you'll also be able to connect in real time with colleagues, friends, and friendly strangers. These interactive experiences are part of what make the CIA virtual conferences truly special and are such a rich opportunity to expand what you learn and who you're learning it from while growing your network. This week's networking topic is: what Menus of Change principles do you focus on most in your operation to drive healthy and sustainable menus? We encourage you to participate in as many of these activities as possible in the spirit of community and sharing that is always central to CIA conferences. And if you participate each of the 6 weeks, you'll have a chance to win a free registration and travel to next year's Menus of Change conference in Hyde Park, New York. As you know by now, we also love to hear what's going on in your operations through our weekly polls. So head to the right of your screen and answer the first poll's questions. Last week, thanks to a wide variety of chefs, operators, and scientists, we talked about the truth behind red meat science, whole grains and carbohydrates, innovation in plant-based products, and inspiration from the Korean plant-forward kitchen, among other things. We're clearly just at the beginning of discovering, or more accurately, rediscovering what we can do with whole grains, from savory applications to the expansion of the bread and dessert pantry. Speaking of desserts, one of my favorite topics, I hope you'll join our breakout today, during which Walter Willett and Ken Tung will dive deeper into dessert flip strategies Greg mentioned last week, along with demos using vegetable in dessert, thanks to Chef Havel Bristol Joseph. But first, this most important session, which will address the essential question of the industry partnering with policymakers in order to achieve the results that we need to truly change our food system. It is my great pleasure to introduce its moderator, Sarah Bleich, Professor of Public Health Policy at the Harvard T.H. Chan School of Public Health. Welcome, Sarah, and thank you for joining us.
Thank you for having me. It's great to be here. So I know there have been a number of sessions that have been going on for the past few weeks, and we're going to switch gears now and look a little bit at the policy landscape. And so in the next 15 minutes, I want to cover 5 recent nutrition policies and give you a sense of some of the evidence to date, and then talk about some of the industry innovations so far. And so the 5 areas that I want to cover are menu labeling, beverage taxes, healthy beverage defaults, front of pack, and then strengthening the public health impact of SNAP, which stands for Supplemental Nutrition Assistance Program. Many of you may know it as food stamps, which was its former name. As I mentioned, for each of these 5 key policy areas where we've seen advances in nutrition policy, I want to give you a sense of where the evidence is. And so as many of you are probably aware, menu labeling passed as part of the Affordable Care Act back in 2010, and it was implemented federally in May of 2018. The goal of this legislation was twofold. The first was to raise customer awareness and reduce calories purchased, and the second was to encourage reformulation. Before the passage of the federal law, there were lots of local policies, of which many of you are probably aware. And those local policies created opportunities for evaluation and to understand, does menu labeling affect consumer behavior? Does menu labeling affect restaurant behavior? And there were about 55 or 60 studies. When you put all those together, what they tell us is that, looking on the left side of the screen, that there's a small signal in terms of customer behavior. There seems to be about a 20-calorie decline in purchases with the presence of menu labeling. I will say that there are a number of studies which show no results, many of those in fast food restaurants. The signal appears to be a little bit stronger for consumer behavior in cafeterias and coffee shops. But if you look on the right of the screen, what that suggests is where the impact of menu labeling appears to be is actual changes in restaurant behavior. And so what that is doing is taking roughly the top 100 revenue generating restaurants and looking over time at the calories in menu items, particularly at the calories in newly introduced menu items. And what we find, this is a study that we did in our group, what we find is that over time, over a 6 or 7 year period, the average calories of newly introduced items dropped by about 120 or 25%. Now that's a pretty significant decline. And the importance of this change from a public health perspective is that changes happening on the restaurant side are not relying on you and I as consumers to make changes. Rather, it's relying on this broader change in the food environment. And what we know from decades of public health research is that consumer behavior is very resistant to change. We all break New Year's resolutions. And so if you sort of create these environments which promote lower calorie choices, it can really promote the public health. And then ideally, it actually doesn't have a negative impact on purchases in restaurants. So the next area, which I'm guessing many of you might be familiar with, but it's newer, is healthy beverage defaults in kids' meals. So starting with McDonald's in 2013, a number of large chain restaurants voluntarily changed the beverage default in kids' meals. So for example, McDonald's started offering only water, milk, and 100% juice in their Happy Meals. Wendy's and Burger King followed pretty soon after. To date, there have been 26 of the top 200 revenue-generating restaurants that voluntarily no longer offer sugary beverages on the kids' menu. Starting in 2015, there were a number of ordinances that started passing around the country in cities and states to implement healthy beverage ordinances in kids' meals. And so if you look at the bottom of the slide, you can see the most recent changes in both cities and states, where Cleveland, Ohio is a city where the most recent healthy beverage ordinance has passed. It's also the case that right now, beverage ordinances are slated to potentially go into effect in 2 jurisdictions in Colorado, but they've been delayed because of COVID-19. So that's an area to watch. Now, the evidence on do healthy beverage defaults make a difference is limited. There is a lot of evidence which suggests that when you make the healthier choice, the easier choice, it can really motivate people's behavior. And that's because we as people are heavily motivated by defaults. We know this from retirement savings. We know this from organ donation. So the assumption is that if you make it such that when a child orders a kid's meal, they automatically get water or 100% juice or milk, then they're less likely to opt out of that for, say, a sugary beverage. But that research is currently underway. Much of it is being led by a team under Alyssa Moran at Hopkins. And I'm part of a research team which is looking at compliance with this regulation. And so this is an area where the research is emerging. It's one of the newer nutrition policies, but it does have potential to target an area of high public health importance, which is sugary beverage consumption, which, as you're probably well aware, if you increase your sugary beverage consumption, you also at the same time increase risk of a host of adverse health conditions like diabetes, like hypertension, and like obesity. And we particularly care about obesity in children because heavy children tend to become heavy adults. And so it's much easier to prevent that weight gain than to try to get children and then adults, for that matter, to lose weight later on. The third area that I want to talk to you about is sugary beverage taxes. So these have been around for some time now, and there are 7 US cities that have implemented beverage excise taxes. They range from 1 to 2 cents per ounce. And because they're excise taxes, that means that the tax is applied to the distributor, who then passes it along to the store, who then passes it along to the customer. So in all the evaluations to date, which are looking at beverage taxes in the US, the first order question is, well, are customers experiencing the full weight of the tax? And that's the question of what is the pass-through of the tax? So that's the first line that you see here on the slide. And overwhelmingly, what the evidence very consistently points to is that if you apply a beverage tax, and again, there are 7 of these taxes across various US jurisdictions, the price of beverages goes up. And that ranges from 8%, and that was a study done in Berkeley, all the way up to an overcorrection of 120% for a study done in Philadelphia. And there's lots of reasons why there's variation. It could be the type of retailer, it could be the city where the tax is implemented, it could be the type of beverage or even the size of the beverage. So the second order question is, if prices go up, then what happens to sales by consumers? Do they purchase fewer sugary beverages? And this is also an area where the evidence is quite robust. And what it shows is that when you put a beverage tax in place, volume sales of tax beverages drop from about 10%, which is what was seen in Berkeley, to up to almost 40%, which is what has been seen in Philadelphia. And then the third thing is, okay, well, from a public health perspective, what we care about is, does that increase in prices, that subsequent decline in sales, does that change consumption? And this is where the evidence is more emerging and mixed. So some studies show null results, which means there's no change. Some show selected declines. Relatively speaking, we have much less evidence on consumption than we do on the questions of price and volume. And from a methods perspective, it's important to understand that it's quite easy to objectively measure the price change of a beverage and then how much customers change their purchasing patterns. It's trickier when it comes to consumption because then you're actually asking people what they're eating and what they're consuming, and that's subject to a lot of bias. And so the take-home message here is that the evidence on consumption is still emerging. We'll probably see a lot in the coming year or so. And then what that will take us to, and we're not there yet, is, well, is there an overall effect on weight? And that's a question that we have not yet answered yet with empirical data. The fourth area is front of pack. And these are warning labels that have proliferated pretty rapidly around the world. They've been adopted by more than 30 countries, in which 9 of which they're mandatory. And the evidence suggests they work by discouraging people purchasing junk and ultra-processed foods. And they also drive reformulation. So this gets back to the same point of menu labeling. A key function of these labels is not just that it's deterring you and I as customers, it's also driving reformulation by the industry. And so Chile has been a leader in this area. In 2012, they passed the food labeling and marketing law, which included the black octagons, which are shown in that image on the right. And that's for products that are high in. So it could mean high in sugar, high in saturated fat, high in sodium, or high in calories. And products in Chile could have up to 4 of these warning labels. Now, since Chile's implementation, a number of other countries have implemented similar labeling schemes, including Peru and Uruguay and Israel. And then there's been a recent evaluation of Chile's food labeling and advertising, which is a suite of 3 policies. The first, national mandatory front of pack warning label system, restrictions on child-directed marketing of sugary beverages, and restrictions on the promotion and sales of these products at schools. And what they found when you put all those policies together is that the purchase of high-end beverages, so think high sugar, decreased by about 24%. And so what that says is that these types of policies can have a meaningful impact on public health metrics that we care a lot about. Again, in this case, the goal is reducing purchases of sugary beverages. So an area which may be less familiar to many of you in the audience, but one I would argue should be relevant and on your mind, is how do we strengthen the public health impact of SNAP? So SNAP, again, stands for Supplemental Nutrition Assistance Program. It used to be called the Food Stamp Program, which is how many people still know it. It is one of a suite of nutrition assistance programs in the United States. We have 15 federal programs, but SNAP is important because it is by far the largest. It has an annual budget of about $65 billion, and it helps about 40 million Americans afford food each month. Historically, SNAP has had two goals. One is lifting families out of poverty, and the second is reducing food insecurity. Those are two things that SNAP has done extremely well. But we can think about, are there ways to increase the public health impact of the program? Because the existing public health mechanisms within the program only touch about 5% of people. And so what this slide is showing you are some potential possibilities in three sort of buckets of categories that would make it possible to promote the public impact of SNAP. Relevant to many of you is that currently SNAP dollars can only be spent in authorized stores, of which there are about 240,000. That almost entirely excludes restaurants, except for a small swath that can be spent by disabled or homeless. There has been recently an introduction of the SNAP CARE Act, which would allow restaurants to accept SNAP benefits, but that is still just in the introductory phase. So I do just want to take a minute, moving apart from policy and just thinking about where has there been some important private sector innovation, particularly that can drive sustainability, which I know is an important concern for many of you listening. And so not surprisingly, there's been a big rise in plant-based growth. And so if you look at the right of the screen, you can see over time in red, the increase in spending or sales for meat alternatives, and then in blue, sales for milk alternatives. And then if you look on the left-hand side of the screen, you can see that imitation meats from Beyond Meat and Impossible Foods are available at nearly 20,000 US restaurants. And so these types of alternatives are going to become important, particularly if the animal part of the supply chain becomes somewhat fragile. And the last thing that I want to have on your radar before I wrap up is just understanding that the Trump administration placed some limitations on the dietary guidelines for Americans. The DGAs, as they're otherwise known, form the basic architecture for recommendations for how we eat and recommendations for many of those nutrition assistance programs that are run by the federal government. And so there are some important changes which could actually change how we eat in the coming years, one of which is the evidence for the link between sugary beverages and weight gain and obesity, which is very strong if you ask any academic researcher, has been downgraded. And that has big implications for the various federal nutrition assistance programs. It's also the case that the covered issues within the most recent DGAs were limited. And so then its ability to respond to some of the most pressing nutrition issues of the day becomes constrained. I want to wrap up by leaving you with three key points. The first is that when you think about sort of the food landscape from a policy perspective, there have been lots of promising areas of progress, particularly from where I sit as a public health person. I would say that there are areas like healthy beverage ordinances where evidence of impact is emerging. And then there are a lot of open questions. So we, for example, don't know that much about equity impacts. Are certain groups affected more than others? Can you use these policies to diminish these long-standing gaps that we know exist in dietary quality and dietary patterns for Black versus white, for example, or for low income versus high income? And then finally, something to keep your eye on is for the emerging food trends and what we know is happening with the dietary guidelines. Those changes may be consequential for our health, and they may be consequential for efforts around promoting sustainability. And so they're just topics that it's going to be important to keep an eye toward in the coming years. I want to stop there and take the opportunity to introduce the panel. And we are privileged to have three very distinguished panelists that can help us think through both the policy landscape and its relationship with the food industry more generally. And those panelists are Jerry Mann. He's a senior advisor to the president at the Center for Science and the Public Interest. He also has an adjunct appointment at the Harvard Chan School of Public Health. Emmeline Feliz, the director of FRESH, World Business Council for Sustainable Development, and Kate McKenzie, the director of the Office of Food Policy for the Mayor of New York City. Welcome, Jerry, Emmeline, and Kate.
Thank you.
Thank you.
And Emmeline, perhaps we can start with you. As someone with expertise on food value chain companies, what do you see as some of the main actions required from the industry in order to support the adoption of health and sustainable diets?
Sure. Well, I guess we can start by saying that as per your presentation, there are two axes on which we can have an impact. The first one is in terms of the product portfolio adaptation and the reformulation that the companies can do. You talked about 120 kilocalories change per meal that can be done just through reformulation. So that's a big axis of work. And the second one is the one that in which you have emitted a bit more doubts about the effect, but it's really how can we also nudge people towards different types of food. So the consumer behavior change angle is also one that we're looking at.
Thank you, Emmeline. Jerry, let's turn to you. So obviously underlining everything that we're talking about is the COVID-19 pandemic. And so can you just help us understand why is it so important that we focus on improving nutrition while at the same time fighting against this pandemic?
Well, thank you, Sarah. And that is an important point because right now, so many people around the world, and especially in the United States, are suffering because of this pandemic, and it has everyone's attention and is affecting everyone's life. And the first area that it's had a noticeable impact on our food is access to food. And so a large number of people, as millions of Americans have lost their jobs, they've lost access to the income that allows them to buy food. Of course, all of the restaurants have had to change the way they operate. Many have not been able to operate. So sources of food have changed as well. And then even in the grocery stores, we've seen things because of the impact the pandemic's had, for example, on the meat supply, shortages in specific foods at various times. But that's been improving. And so while there's that aspect that we need to be concerned about immediately, there's also something about the quality of diets and how it's impacting the outcomes with the pandemic. And so in America, we face, in addition to the large burden of disease we're faced with, we're having more serious illnesses and likely more deaths because so many of us are metabolically unhealthy. In fact, 88%, according to the scientists, are metabolically unhealthy, meaning they have diseases such as high blood pressure, heart disease, diabetes or prediabetes, or overweight. And so not only is that an ongoing problem, because in a larger sense, we've been in, and why so much work, such as the CIA's program and others, have tried to bring down the level of diet-related disease because it's making so many people sick. It's driving up our healthcare costs and even undermining our military readiness and affecting the climate. And so those have been ongoing challenges, but these issues are as important as ever right now during the pandemic because of the unhealthiness of most Americans is driving poor outcomes with this disease.
Thank you, Jerry. Kate, I want to turn to you. You living in New York City, being in the mayor's office, have been at sort of the epicenter of COVID-19, and that's obviously had a huge impact on the restaurant industry. So in terms of the city's response and the efforts to help the restaurant industry as a very hard hit sector, can you walk us through some of the things that the mayor's office is doing?
Sure. Thank you for that question and to the remarks that my colleagues have made. It has been almost 5 months to the day that we have stood up massive operations to ensure that all New Yorkers have access to food, given the considerations and the realities that Jerry mentioned, particularly for our elderly. The public health guidance, as we all know, is to stay inside as much as possible. To date, we've procured and distributed more than 120 million meals that have been delivered to individuals' homes using our taxis. What I would like to suggest is also, while we've made a clear priority to ensure that no New Yorker goes hungry and ensuring that there is short-term food security, we can always take better steps to ensure that that food security is aligned and in sync with nutrition security. We have centered our work certainly on the long tradition and legacy that the city has around nutrition standards. I'm sure many of the viewers know that back in 2008, by executive order, we ensured that all foods purchased by the city align to those nutrition standards, and are doing our darndest to make sure that all of the vendors that we have secured to do this emergency home deliveries adhere to those to the greatest degree possible. But I also want to mention and highlight another sort of unique sector in New York and everywhere in the city, in the country really, which is the restaurant industry. And it has been decimated. And we need to make sure that that industry can come back to ensure that people of of all walks of life still have access to restaurants. It's not just a matter of being, wealthy that you go to restaurants. Restaurants are here for all New Yorkers in many shapes, forms, and sizes. And, we have, through October, have allowed our streets and sort of our storefronts to be able to function in outdoor settings for restaurants. But I'm really worried, to be honest, about after October, how these restaurants will continue to survive at functioning at 50 or 25% capacity. So we need to make sure that our New Yorkers are centered in our relief work, in our thinking about how New Yorkers maintain access to food. We've partnered with One Fair Wage to make sure that some of those restaurants are provided with grants to help just get staff back and working. The other thing I would like to say is that that's come into really sharp resolve over the course of the last several months is certainly the nutritional quality of food, but also the cultural appropriateness of that food, whether it's kosher or halal meals or different Asian and Latin perspectives. Really making sure that we center both cultural appropriateness as well as nutrition is top of our minds and in all of the efforts that we continue to deploy.
Kate, thank you. And let me stick with you for a second. And I'd also like to hear from the perspective of New York City, thinking about value chains. And what can you say about the city's role in terms of governance related to value chains?
Yeah, thank you for that question. We, for the last, I would say, concertedly over the last year, but certainly over the last 2 years, New York City has been partnering with the Center for Good Food Purchasing, and we are working to align our food purchases with the values, particularly, again, those legacy values of health and nutrition, but also around local economies and around environmental sustainability and good, solid workforce and many of those values. So we believe it is, a strong governance role that we have to direct our public purchases to align with those values and ensuring, again, particularly in times of crisis, ensuring that we can have short supply chains and really rely on our region and the food businesses and the manufacturers within our region is integral to how we can be able to be even more resilient in times to come. Again, that those can be of certainly large scale, but also small scale, and how we can find a place at the table, so to speak, for all of those entities is critically important to the administration.
Thank you, Kate. And Malene, let's go back to you. And we talked a little bit about reformulation, but when it comes to menus or product portfolio or reformulation, what are the most critical changes that you think need to happen in the coming years from where you sit?
Thank you for this question. But I think I would like to add a layer. We're talking nutrition here, but we also all know that this system is a whole food system in which everything is connected. And so what we think is really critical is to look at how to reformulate and to change product portfolio and to deliver menus that are healthy, but also that are sustainable. Because if we do not correct the trajectory of our food system today, we will further destroy the resources of our planet. And pandemics like this one we just saw are just going to continue even more. So it's really critical that we integrate both. So we really look at healthy and sustainable diets. And in that sense, there are 3 critical changes that need to happen from our perspective. The first one is changing the nutrition of the processed food, processed in one way or another, which is basically reducing what is less desirable in the food: sugar, salt, trans fats. And the second one is to increase what's desirable in processed food, which is, for instance, whole grain or nutriments. And when doing that, always keeping in mind that whenever you have different choices of products, you also have different choices of where they come from and how they're produced and what's the impact on the environment. So that's the first one. The second one relates to protein. Protein is a very symbolic and very debated subject. Because everybody cares. We talked about cultural considerations. Kate was very right. This is critical in food for more than any other aspect, actually. But basically, everybody cares about the protein they get. Some people feel vegetarian, some others feel like they want to have several steaks a day. But in any case, we know that the animal protein production today, the way it is happening in the world, is driving a big share of the greenhouse gas emissions, for instance. And it could be contrary. Actually, we can use practices that, regenerative agricultural practices that actually capture greenhouse gas emissions. It can also contribute to biodiversity preservation, but it all depends how we do it. So having a good mix of proteins from plant and animals and making sure these are produced sustainably is a second really important thing to work on. And last but not least, it's the consumption of plant-forward foods. Not just protein, but basically fruit and vegetable and nuts and pulses and whole grain. All of that today, the lack of intake and consumption of plants is the biggest driver for non-communicable disease and actually for death in the world, even before smoking. So there is an urgent need for us to really change that curse and really get people to eat more plants from from rich plants and diversity of plants for the benefit of people and the planet.
So Emeline, before we leave you, for each of those three principles, can you maybe pick one and just talk about some of the supply chain challenges to making them actually happen?
Sure, there are many challenges. I guess the first one on the processed foods. The issue is that a lot of the companies we work with have a lot of goodwill and really want to do the right thing. So they try to reduce levels of sugar. But what happens is that often the market doesn't follow. So in fact, a lot of people are used, whatever the reason is and whatever the share of the responsibility is across different actors. The reality is today that people are used to a certain level of sugar, for instance. And if you drop it too much, they just move to a competitor. They just don't stop using as much sugar. So that's a very big hurdle. And that's where policymaking is actually critical, because we need everybody to have the same level playing field in order to be able to compete towards better types of food. For protein, I think the cultural challenge is the biggest one. Like I said, people are very, very antagonistic views about I want to eat my meat or I am vegetarian. And what we really believe is that everybody is in the same pot. We need to all work together towards a good mix of proteins that are produced sustainably. And there is a lot of work to be done across the value chain at every stage, every level, with the farmers, the traders, and the consumers. So that would be a second case. And the last one on plants, I would think, while we're looking at how to change consumer behavior, and we see that there are a lot of factors that actually condition the way people are eating. And by the way, those factors are different depending on the population segment. So what is going to trigger you to buy something is different from what is going to trigger your neighbor buying something. But in any case, we really need to understand those different factors and to work hand in hand across the different stakeholders to align the right changes so that people can start wanting to and being able to afford more plant-based produces, for instance.
Thank you. And Jerry, since Emeline mentioned policy, I want to turn back to you. You recently helped lead the 50th anniversary, the report about the 50th anniversary of the 1969 White House Conference on Food, Nutrition, and Health and those recommendations. And so can you give us a high-level sense of what was in that report and why it's so relevant for the audience listening today?
Sure. So 50 years ago, as you know, in 1969, the nation faced a different type of nutrition crisis with hunger. And it was discovered that the type of hunger that people often thought about in other nations, calorie protein malnutrition, was here as well. And what's important from that conference is not only did it bring stakeholders together, but it unleashed a torrent of policy change from the federal government that we hadn't seen in almost 50 years before that, when the issue was food safety. But you look at today's landscape, and programs the beginnings of Food Stamps SNAP and school meals started before then, but they really took on their current form with the reach that they have as a result of that conference. In addition, new programs like WIC came out of that conference, also food labeling and dietary guidelines. And so you see the enormous amount of policy that's put in place. And then you look today, and when you look at the Department of Agriculture and see that it has $100 billion with a B and feeding programs, the 15 you mentioned at the outset, that's as a result of that policy and enables us to meet that challenge. Still a big problem in food insecurity, but not the kind of hunger we saw before. Today, we face a very different nutrition crisis. Some echoes of before. Food justice is certainly an issue. As I said, food insecurity is an issue. But now diet and disease has become an overriding issue, as I noted before, with so many Americans sick, high healthcare costs, and national security threats because of that. And then, as also been discussed here and in previous sessions, impact on sustainability and the climate crisis. So this conference was an effort to update the recommendations from 50 years ago, and focused on those three main areas: on food justice, on diet and disease, and on the sustainability of the food system. It includes 60 recommendations that have been supported now by more than 40 groups, and provides a plan, an agenda for possibly a next administration or this administration, and how we can respond to today's crisis.
And staying with you, Jerry, what can the restaurant industry do to either help address issues related to diet-related disease or issues related to sustainability that both you and Emmeline have mentioned?
Well, they play a critical role because of how much people eat out. And as we know, half of consumer dollars are spent outside the home. Even now, of course, people, it's more difficult, but people rely on them for food. And it really is a matter of an opportunity to change how food is, and also because of how it's presented. One of the wonderful things I think that first caught my attention in the Menus of Change program and continue is adding, along with healthy diets, the idea that it needs to be delicious. Having worked in this field of healthy eating and public health for a while, often people focus on the need for people to make healthier food choices. But for too long, I think there was sort of a sense that it had to be a sacrifice that people made in order to eat healthier. And I recall even at the end of the Obama administration, all the great work that Michelle Obama had done. And the first interview after his presidency, Barack Obama was talking again about how he's learned that he needs to, eat, might not enjoy his food as much, but, it's important. And that is just not true. And I think that people in the restaurant industry see that better than anyone. They see how the creativity that's been unleashed, trying to respond to changes in consumer demand, have resulted in just vast opportunities of new customers, new types of dishes, new interest, new excitement. And so I think it's important that the government plays a critical role in changing and addressing this problem, but can't do it alone. And it will require food companies, particularly the restaurant industry, and chefs play such a big role in this to solve the problem. And I think what we need to do, what we're doing, for example, at the Center for Science of Public Interest, is looking at these entities and saying, are they part of the problem or part of the solution? And I think people are doing a great job on the solution piece in terms of the products, showing people that delicious eating and healthy eating are one and the same, that if you think that somehow it's a sacrifice to eat healthier, you've got the wrong chef, or you're eating at the wrong place. And that can be addressed. But it's important in other areas as well. If you work for one of these companies and they are working on the menus, I think it's important also to ask how they're spending their government relations dollars and what they're lobbying for, because we need to align what government is doing and what's happening at the consumer interaction level. And to do that, it's harmful where companies are stepping forward to offer more healthy products, but then, for example, spending quite a bit more money lobbying to block taxes and other effective interventions.
And Kate, from where you sit, what do you see as important role for the restaurant when it comes to either diet-related disease or sustainability?
Thank you, Sarah. I want to build on certainly what Jerry said, and also something that you raised in your wonderful opening. That the history certainly of the White House conference is helpful. And I think that certainly programs like SNAP need to evolve also with these times that we're living in. And so, to hear about the different eating behaviors, the fact that people are eating out of their homes, It's not necessarily a treat like maybe it was when I was a kid, but it's also it's just how people get by. And so I think you mentioned the not well known fact that the state of California and hopefully others, including New York, will start to enable restaurants to be able to participate and be recipients of SNAP. So, for instance, it's actually, you're right. It is the homeless population. It is disabled. Seniors. It's seniors, and seniors are those people right now who are most, in some ways, most impacted as a result of COVID. And so, whether it is figuring out a way for restaurants to be able to marry certainly the food insecurity values with the public health and chronic disease prevention values, I think that's a significant opportunity, as well as in other online retailers as well. I think that having the support and certainly the influence that the restaurant industry has in that conversation, again, centering it on health and nutrition as a way to address food insecurity could be powerful.
Thank you, Kate. And I want to encourage those of you who are listening to send in questions. We do have one from Anastasia Joyner, and I'm going to just go ahead and read it. Is there evidence that supports one system of policies that is more effective than another? For example, consumer education versus taxation in affecting positive consumer change? Jerry, do you want to try that one?
Yeah, I'll try that because, at the Department of Agriculture, where I worked in the Obama administration with you, Sarah, we do both. And we spend over $1 billion a year on education in various programs, but also, much more than that on the feeding programs. And I think there's a role for both, but I think it's important for people to know the evidence is overwhelming. And this is something the Centers for Disease Control, CDC, has seen as well. And, the education is, I think, helpful when combined with changing the food environment, but alone doesn't really move the needle. Where we saw an outstanding result with the change in the school meals that we worked on together. USDA did a big study after that saw how kids are eating before and after the changes of the standards for the school meal. In effect, what we're asking restaurants to do in terms of making plant forward and making changes in their menu. And what we saw was that up until the change of the food standards, a healthy eating index score, a unique government measure of how people are eating, showed that school kids, like most Americans, had a score around 58, sort of a failing score on their diet. 3 years later, because of not education being served at schools, you saw the diet quality of those meals increase 40% to 81, very passable score. And since then, another study has shown that, in particularly in low-income kids, childhood obesity has gone down. And so I think there's programs like that work better when they're combined with education. But I think the main message we've seen from the evidence is that education alone is helpful, but not sufficient to really get change. What you need is to make changes in the food environment, and those types of changes, whether they're changing what's on your menu, changing the price of things, what the defaults are the much more effective interventions.
So thank you, Jerry. We have just a few minutes left and we're getting some good questions from the audience. So let me try to direct the last two to Emmeline and Kate. Emmeline, I'll go to you first. And the question is, how can the public health community better engage chefs in translational research around industry strategies to achieve more healthier, sustainable food choices?
Thank you. Well, as I represent more the business, it's a bit difficult to say how the public health community can do that, but I can give some suggestions. So, I mean, more than ever now, I think all of the stakeholders are open to collaboration across different groups. There is going to be next year the first UN Food System Summit, which has identified healthy and sustainable diets as one of the key tracks. And so in that context, all of the stakeholder groups, meaning the policymakers, but also the businesses, and also NGOs and representatives of all of the communities would be brought to the same types of rooms and discussions to really see how can we work together towards healthy and sustainable diets. In practice, we in the Fresh group, we do work with a lot of different people, and there are groups like the SDG 2 Advocacy Hub and other groups that really include chefs, the Chefs Manifesto group, where they really work with chefs to bring them to the up to the front of the questions about healthy and sustainable diets, and really to the point of Gerald and Kate, making sure that the chefs can develop extremely appealing types of menus that are actually healthy and sustainable. And as a conclusion, what we know is that people are very rarely choosing something because it's more sustainable. They would choose something because it's more appealing, because it talks to them, because it's also sometimes perceived to be more healthy. So we need to really combine all of that. And that's the big role of the chefs in a restaurant, and the chefs as well that help to formulate products within a company.
Thank you, Emily. And Kate, we just have a few seconds left. So this is going to be a quick answer, please. But what does success look like in 1 year for the restaurant industry in New York?
To exist. Honestly, we are at that place where we just need to make sure that this industry that certainly feeds New York, but also employs New York, has supports to be able to make sure that it can continue to be the strong pillar that it is.
Thank you. Jerry, Kate, and Emmeline, thank you very much for your insights and for this conversation.
Thank you so much, Jerry, Emmeline, and Kate, indeed. And this conversation will actually continue in breakout E2. So if you want to hear more from these wonderful panelists, join them there during the breakout session now. So we are going to breakout sessions, which you can access from the Sessions tab on the left side of your screen. And we'll be posting recordings of all of the sessions on our website, so you're not missing out by going to just one. Some of the sessions include time for audience questions, so jump into the conversation by hitting your green share your audio and video button when prompted, and you can also always enter questions in the chat, of course. Before we head to breakouts, let's see how our poll is doing. So we asked you which area interests you the most for strategies related to current and future regulation. And what comes way ahead with about the same number of votes as the following two items is mitigating food waste, followed by lowering our carbon footprint and reusable, recyclable, compostable packaging. So thank you for providing your opinion there. There will be another poll later on, so keep checking when you come back. And looking forward to seeing everyone back here in the next for the next main stage event. In the meantime, enjoy the breakouts and enjoy the break after that. Thank you.